Hey everybody, my name is Manny Mustakakis. I'm a cardiologist in New York City, but I'm originally from Houston, grew up not too far from Katy, Texas, and it's my pleasure and my honor to be invited to talk to you guys today about some about the circulatory system, about arteries and veins and capillaries. We're going to do a little bit of a discussion about the difference between the different types of blood vessels, and then I thought maybe we'd talk about a little bit of something maybe different than what you've probably heard from your textbook and from your teachers in school, maybe something about different disease states and ways that we treat disease process of the circulatory system in cardiology. Maybe we'll get a chance to talk a little bit about medications that we use, a little bit about some of the procedures that we can do in our cath lab here in the hospital, and maybe finish with a few minutes talking about something related to healthy lifestyle choices and changes and things that can impact how we keep our blood vessels healthy. But I'm sure you guys probably already know there are, in general, three different types of blood vessels: arteries that take blood generally away from the heart, veins that bring blood generally towards the heart, and capillaries, which are the junction between the two, which is where exchanges take place. So capillaries, for example, are pretty straightforward. They're first off, they're microscopic. They're not something that you can see grossly if you're taking images of arteries and veins. But it is the one place where exchange happens. So, for example, when you look at arteries that pump blood to the lungs, it's the capillary bed in the lungs, which is where oxygen exchange takes place and carbon dioxide is eliminated from the body, and then oxygenated blood returns back to the heart from pulmonary veins. And you guys, I'm sure, probably are familiar with some of that. Also in the capillary beds on the systemic side, which is not the lung space, but in other parts of the body, different organ systems in the body, that's where exchange takes place with different metabolites, nutrients, and so forth. That's where medication gets absorbed in and out of the bloodstream. So capillaries are pretty straightforward that way, but in a lot of ways they're kind of boring. We like to spend a lot of our time talking about arteries and veins. So let's dive in a little bit into the difference between the two. Arteries generally are muscular structures. They're high pressure systems. So when we talk about, for example, someone's blood pressure, a normal blood pressure, I think we might consider to be 120 over 80. You might have heard those numbers before. 120 over 80 is a pretty normal blood pressure. That's the blood pressure in the artery bed. So an artery has a high pressure system. How does it do that? Well, it has multiple layers. There are three layers in the arteries. They're called intima, media, and adventitia. But in general, if you think of it just in terms of a muscularity, there's a smooth muscle layer in the walls of the arteries, and that's what gives the contractile ability, the ability for pulsatile flow from the heart, for high pressure flow to deliver blood to all the different parts of your body. Because arteries have a musculature and a nervous system about them, it's important that we always understand that arteries are dynamic structures. They're not lead pipes. They're not stagnant like that. They can dilate, they can constrict, and usually that happens in response to some kind of stimulus, some kind of hormonal or neurologic nerve type of communication from the brain to the artery bed or other hormonal activation sites, whether that's hormones that get released by the kidneys or wherever. There's a muscularity about the arteries that allows them to dilate and constrict, and that's how your body can regulate how different amounts of blood get diverted to different organs, and that can be really important sometimes. So examples of that, maybe if you have a big meal, your gut has a lot of work to do. Your digestive organs have a lot of work to do. So there might be hormonal factors that dilate or allow for more blood flow to be diverted to your gut organs because they're doing a lot of work and they need a lot of nutrition and a lot of exchange there. Or maybe there's other times when you're in a really cold situation. You're outside, it's very cold outside. It doesn't happen that much in Texas, but in New York City it happens a lot. And if you're outside, then your body core temperature needs to be maintained, so blood might get diverted away from your hands and your feet, which are considered less essential, and into your core system, where to keep your core temperature regulated. If we think about in terms of how blood pressure medications, for example, work by affecting the dilation and the constriction of those arteries. A lot of it, the muscular tone is affected sometimes by hormones. Sometimes there are a number of medications that relax the smooth muscle in the wall of the arteries. There are a number of medications that impact the hormones that cause the constriction and the relaxation of the muscle in those arteries. So that's kind of an overview of the muscular structure of arteries. Let me take a pause for a second because that's a lot to take in. So if you're a little bit confused, just take a deep breath and let's move on to veins. There's a big difference between arteries and veins. Veins are a low pressure system. Veins generally are much thinner walled structures. They're usually a little bit bigger. They're a lot flimsier. They return blood to your heart by passive flow. Passive means as opposed to active. Active means your heart's pumping and pushing. Passive just means it's being returned without the force of contraction. So it's a much lower pressure system. If you were to put a catheter into a vein in someone's neck or a vein approaching somebody's heart, instead of 120/80, you might see much lower pressures, maybe 10 millimeters of mercury or 20 millimeters of mercury. Those are very low pressure systems. So the easiest way to see the difference with that is that basically you look at if I was to put a catheter or a tube into an artery and a tube into a vein, like a big IV. If you take an IV out of someone, it might bleed a little bit, but you put your hand on it, it stops, and you put a Band-Aid on it and it stops, because it's a very low pressure system, and so it's very easy to get blood to stop, a vein to stop bleeding. An artery is not the case. If you put a big enough tube into an artery, it's going to spurt blood out, and we see that sometimes in the cath lab here at the hospital. The blood spurting out requires compression. You have to do something to a hole in an artery to get it to stop bleeding. If you can compress it until it stops, or you can put a little stitch in it to get it to stop, or you can put any of a number of different closure devices. But because they're higher pressure systems with pulsating flow, if you hit an artery, then it's going to continue to bleed. And that's a lot of times, for example, in places like trauma surgery, when you see patients come into emergency rooms with gunshot wounds or stab wounds or car accidents where an artery was hit or an artery was lacerated. A lot of times those become life-threatening events because of how quickly blood can escape from an artery. So an artery is a much higher pressure system. The capillaries we talked about a little bit. So let's move on to a little bit about the various disease states. How do arteries and veins differ in the disease process? Well, on the vein side, you can imagine that if you have a low pressure system, blood that tends to pool and doesn't move very well is a little bit more prone to forming a clot. So sometimes you talk about when we don't move, when we stay immobilized, we can form blood clots in the veins, particularly in our legs, and sometimes those will travel to our lungs, and we get blood clots in our lungs and make it very difficult to breathe and can have a lot of damaging effects. It can cause a lot of heart muscle strain, it can cause heart failure, it can cause respiratory failure. So things that predispose to the formation of blood clots in veins include long periods of immobility. So we talk about if you were to take a very long car ride and not get up and stretch, like several hours, 6, 8, 10 hours in a car. If you were on a very long plane ride, maybe you're flying from here to Japan or from here to Europe and you don't get up and you stretch. A lot of times those prolonged periods of immobility will lead to the formation of blood clots. And if blood clots form, they can cause swelling in your legs. If they travel to your lungs, they can cause respiratory failure and other dangerous life-threatening problems. When we talk about artery states, the arteries are a little bit different. You can get blood clots in arteries, and that's usually a really bad thing, but usually with arteries, we're talking more about blockages. So for example, in the coronary arteries, it's very common when we talk about heart disease that people will develop fatty streaks in the arteries of their heart or in the arteries towards their brain or in the arteries of their legs. They can develop hardening with calcium deposits. They can develop fat and cholesterol deposits. And any disruption in flow of blood into the arteries can have a lot of serious consequences. So I'm a cardiologist. A lot of what I do is treating people's coronary artery disease if they have blockages in the arteries of their heart, whether that's a sudden disruption of blood flow with a blood clot, which might lead to a heart attack, whether it's a chronic hardening of arteries that might lead to chest pain when somebody walks, for example. A lot of people have no chest pain whenever they're at rest, even though they have severe blockages, but when they start to move and their heart's forced to work a little bit harder, those blockages limit how much blood and oxygen get to the heart muscle, and it can cause it to suffer and cause people to have chest pain. So blockages, cholesterol buildup, calcium buildup, those are big ones. Blood clots. Blood clots can form in coronary arteries in people who are having heart attacks. Blood clots can form in brain in the brains of patients that can cause strokes. Blood clots can form in people's legs who have um, a lot of blockages in the arteries of their legs. And then there's other disease processes that can cause blood clots to form in arteries. But generally, blood clots are bad anywhere, but they're really bad in arteries because they cause damage and injury to the organs that those arteries are supplying. You can have things like dissections. So what is a dissection? A dissection is when one of the layers of the artery wall separates from the rest. And remember in the beginning, we talked a little bit about how the different layers, there's 3 different layers of artery wall. And sometimes people will have a separation of the inner layer from the rest. And when that happens, there's a propensity for blood to flow inside the wall of the artery, which is a bad thing. There's not supposed to be blood there. So dissection anywhere in an artery is bad. They're often life-threatening problems. If it happens in a coronary artery, it can lead to a big heart attack. If it happens in the aorta that goes out of the heart, that can cause devastating, life-threatening consequences, and it can be pretty rapidly fatal. So that's one of the emergencies in my line of work is treating dissections and aortic dissections. When we talk about the treatments for these processes, so some cool stuff that we're able to do, and maybe in a few minutes I'll see if I can film a little bit from inside the cath lab here at New York Presbyterian. There can't be any patients in there, so I got to be a little bit careful, make sure that there's nobody in there. But if we get a chance in a few minutes, we'll talk about some of the, we'll see if we can get a sneak peek at some of the stuff that we have and some of the equipment that we use. But we can use catheter-based equipment to use balloons to open up blockages in coronary arteries, for example. We do that all the time in people who have chest pain from blockages in the arteries of their heart, people who are having heart attacks from blood clots in their heart and blockages in their heart. What we do is we'll put catheters into an artery from the arm, from the forearm, or an artery from the leg, and we use x-ray guidance to place long tubes called catheters into the arteries of the heart. And when we have the catheters engaged in the heart, we can inject a contrast medication that lights up a monitor, shows us where the blockages are in the arteries, and then we can snake a wire across it, put a balloon in there, and open things up. Sometimes if there's blood clot, we'll use hollow catheters that we can suck from the back of with a syringe from the back. We can suck out blood clot to restore blood flow and use a lot of pretty cool equipment to stent blockages. Stents are like little mesh tubes. We can put those in to open up blockages. We can give a lot of medications into arteries. We can give blood thinning medications into arteries or antiplatelet medications that prevent blood clot from forming in arteries. So there's a lot of really cool stuff you can do with catheter-based delivery of equipment. People who are having blood clots in their lungs, we can put catheters on the venous side into the arteries that go to the lung space, and we can use clot-busting medication to try and sort of dissolve the blood clot that's in the lung space. Sometimes that's really effective and can make people feel better really quickly. So that's what we can do. A lot of the stuff we can do with medications. There's a lot of stuff that we can do with oral medications or IV medications that you don't even need equipment. You can give blood thinners through IVs. You can give blood thinning medications by mouth to prevent blood clots and to treat blood clots. So there's a lot of cool stuff you can do on the artery side. And then really the best thing is about prevention. So maybe I'll spend a couple of minutes talking about how do we prevent injury to arteries and how do we minimize the chance of forming blockages and blood clots and so forth. And it really comes down to understanding some healthy lifestyle habits that really start at a very young age, because we know from autopsy series, which is kind of not something that we usually like to talk about, but we know from autopsy series that people can develop fatty streaks in the arteries of their heart, for example, as early as their teenage years. So people will see evidence of of blockages that will start to build up and cholesterol deposits that will start to build up as early as the teenage years. So even though a lot of people don't really get true heart disease or significant enough blockage until many years and decades later, it starts at a very young age in childhood. And so a lot of that has to do with healthy eating habits, healthy exercise habits, and avoiding sort of toxic behaviors. So the biggest risk factors by far for coronary blockages and for strokes and for damage in the arteries of the heart, first is smoking. There's no question that smoking causes hardening of the arteries, it causes high blood pressure, it causes a lot of really bad things, but you guys probably don't need me to tell you that smoking's not good for you. It's important to understand how that acts as a risk factor. Um, High blood pressure is a significant risk factor. So how do we prevent high blood pressure? How do we prevent inflammation in the arteries of the heart that leads to the fatty streaks and the blockages and the cholesterol buildup? It's really not as simple as just not eating really fatty food. A lot of it has to do with the genetics that we have or the exercise that we do. We learn more and more every year about how regular exercise can really minimize the inflammation in our arterial system. So whatever it is that you like to do, if it's running, if it's basketball, if it's swimming, any type of regular aerobic activity 3 or 4 days a week is going to do a great job of um, minimizing the stiffening and the hardening of arteries in the vasculature in your arms and legs, and also in preventing the buildup of fatty streaks and coronary blockages. So having a healthy dynamic structure where your arteries stay spongy, stay resilient, they still dilate and constrict many years later. Those habits come from healthy exercise habits. How do we change the deposit of cholesterol in the walls of the arteries? A lot of times, healthy exercise and aerobic activity is implicated in changing the composition of our cholesterol levels. So if you get your cholesterol checked and you have a high number, but it's all the good cholesterol and less of the bad cholesterol, then that's a good thing. That's protective of your coronary arteries. And we know that people who engage in a lot of regular aerobic activity have a lot higher levels of good cholesterol and a lot lower levels of the bad cholesterol. So healthy eating is important, healthy exercise is important, not smoking is critically important. So I hope that gives you guys a little bit of an oversight and an overview of the circulatory system, of the differences between arteries and veins, and a little bit about boring capillaries, maybe a little bit about the different disease states and how we treat them and how we prevent them. And so I'm going to pause here and I'm going to see if I can get into the cath lab and just give you guys a quick view of some of the cool stuff that we do. If I can, then give me 1 second.